faculty member with the Simulation and Innovation Center, Sarah Case, and a student in medical careers, Gloria Monroy. Welcome to the show.
Thank you for having us.
Yeah, nice to have you here. So I learned just before the show that not only is Gloria a student at Jackson College, you're a student somewhere else.
Mm-hmm.
Where else?
At Jackson Preparatory and Early College.
So you're a high school student at JPAC
Mm-hmm.
and a college student at Jackson College.
Mm-hmm.
Yes.
Is that unusual?
No, it's a great program that they have with JPAC and Jackson College. So Gloria here has completed the medical assistant program. So even before graduation, she is going to be certified medical assistant, have her associate's degree, working towards a bachelor's degree, and has started the track for pre-physician assistant, all before graduating high school.
Wow.
It's amazing.
At
Yeah.
the low cost of zero, right?
Yeah, huge benefit.
That's
Yeah.
awesome. And you have to walk across the parking lot or across the courtyard to go to college?
That's right. It's all right on Jackson College, and I think JPIC is such a good opportunity for the young generation. Now that you can go to college for free, and I'm going to take it while I can get it.
Awesome. Yeah, what an opportunity. So what is it that you want to do ultimately as a career, Gloria?
Ultimately, I want to become a physician's assistant and work in the trauma unit, I think. I just like the adrenaline rush.
Really? The trauma unit?
Yeah.
Oh my gosh. Wow. Does the sight of blood make you queasy?
No, I love to see blood and guts. It's just so interesting to
Bring
me.
it on. Brandon, I think we have a couple of pints in the refrigerator. Sarah, you've been able to educate students with really cool state-of-the-art facilities and
Yes.
equipment.
Yes.
Tell us a
If you
little bit
think it
about
could be
the...
serious, ask me to call emergency services or
Oh, I
someone
think
you
so.
trust.
I said trauma, and it's
Oh.
going to call 911. I'm sorry, Siri. We're all fine.
Didn't know those features were available.
Jeez, it's sharp. I can't believe it. It's like, sorry, Siri. We're all fine. So you have some really cool...
We do. Yes.
All right, without mentioning trigger words for
Right.
Siri, if
Now
you
that we
tell us a
know.
little bit about what the Simulation and Innovation Center is all about.
Yes, well, recently we were able to expand to cross-curricular simulations, which is a advancement for us. So we have the science department. The instructors approached us about doing this simulation for their students. Gloria happened to be in that class as well for the anatomy and physiology. So what we did, the instructors created the simulation, and then we put moulage on the mannequins to make them look like they had wounds, and one came in contact with power lines. And then the students would come around and they would describe the wounds and talk about the structures underneath the wounds, what could have been impacted. So they're taking their classroom anatomy and applying it to a realistic scenario and seeing what a hospital room would look like, an ER setting with monitors and the vital signs, and taking notes about what they see in hand.
Awesome.
Yeah.
Well, we have some photos from the Simulation and Innovation Center from a few weeks ago where you hosted community members on tours. And I was there, and I couldn't believe the equipment. There's Chad Noble. He can't believe that's not a real baby.
She's so cute.
Yeah, she is cute. So, what are the careers? What are some of the things in the Innovation Center like this? This is what is this?
Oh, the VR headset. Yes. So our dean has this amazing vision of creating a metaverse throughout the simulation center. So people in the hospital or off-campus sites, our other satellite campus sites, can all come into the simulation center virtually and interact with students, instructors, and just create this whole new world of simulation. And that VR set has a really cool option on there where you can walk through a heart cath and you can flow through the heart.
You can make yourself into a teeny little person.
It seems like it, yeah.
Wow.
Yeah, it's just fascinating. And then the anatomage table, Brian Carter, he's the one that actually created the the simulation that we did for the anatomy and physiology students. He is great at the anatomage table, which is a virtual cadaver, essentially. And you can dissect it, you can pull out body systems, so it's a great tool for the sciences.
And Mindy Bradish Orta, she's looking as if she's about to order some appetizers, but it's not what you think, Mindy. It's, and that moves, you touch it and
Yeah,
you can
It's all
zoom in.
interactive. It's
Yeah.
amazing. Yeah.
Big rooms, and this equipment, are you hands-on, Gloria, on some of the things we're seeing?
Oh yeah, I got to use the table before and play around with everything, and you get to learn. I cut the person open on it, and made its heart beat, stopped its heart from beating, you know.
Well, let's talk about that situation where you have a mannequin that you've put in clothes and you've simulated a power line injury.
Yes.
So do you know, do they tell you what's happened, or do you have to observe and figure out what's wrong with the guy?
Well, going into it, he let us know, like, this patient has been wounded by a power line, and it really shows us firsthand how you assess a patient in the medical field and talk in medical terms so everyone else on your team understands what you're talking about, essentially.
And you can make the people, they can even bleed too, can't they?
They can, yes. Yep. They all have tubes that you can hook up external blood to. And during that simulation, I did have a squirting wound. I turned it off for the Starry Nights, though, just to be sensitive.
They're screaming?
Well, no, they all handled it
Just
fine.
bleeding, no
Just
screaming.
bleeding, no screaming. We can make them scream, though,
Yeah.
but we
The
try
baby-
not. The baby definitely screams and cries. So does the pediatric one that we have, yes.
Yes, I heard the baby cry.
You did hear
I
Great.
thought it was real.
It
I thought there was a
sounds
Yeah,
wa-
she does sound real.
Yeah,
Yeah.
and her movements and everything are realistic.
It's fascinating, but more importantly, it's career preparation
Yes.
like nothing else. There's not another school like that
Right.
does this, is there?
Not in this capacity. And the pre-PA class and track that we are forming with Grand Valley is very rare to have. So we are very excited about it.
So I'd never heard of pre-PA,
Yes.
PPA,
Yep.
PPA, and so it's a job. A medical office would hire a pre-PA,
Nope.
or no?
So pre-PA is just to prepare you to apply to PA school.
Oh.
Yes, you need a bachelor's degree to apply to the PA profession. So there's a lot that goes into even being ready to apply for the PA program. So that's what we are teaching.
And that, I would guess, is a very high in demand profession.
Very much so, yes.
Jobs like that.
Yes. And with physician assistant, you can be any specialty you want to. So I could work in cardiac surgery, and then tomorrow say I want to do emergency medicine or pediatrics, or we're certified across the board for any field.
But Gloria wants to work in trauma,
She does.
the ER. Do you guys get to go into Henry Ford or anything?
She wants us to start doing volunteer hours to just get that on our portfolio because it looks good for your PA school and stuff. And I'm looking into volunteering at a hospital so I can then get volunteer hours with someone who's in the trauma unit as a PA.
So are you going to do year 12 right now? So are you going to do year 13 here at JC and JPEC?
Yep.
And then what?
And then finish my bachelor's, apply for PA school, and do my master's.
That's right.
And where do they have is Grand Valley a PA school?
There is, yep. There are many across the state of Michigan. I personally went to Wayne State, but we are building the track with Grand Valley. So we are working a really nice kind of a bridge from your associates to your bachelor's to the PA program. So they're partnering with us.
And can you take Grand Valley classes at JC?
Yes.
Oh, wow.
Yeah. Yep.
That's awesome.
Yeah.
So you'll, in like how many years will you be then able to go out and apply for a PA job?
Essentially, for the bachelor's degree, it's really 3 years at JC, 3 years at Grand Valley, and then you can apply to PA school in
Yeah.
however many years that takes.
The PA programs are roughly about 2 years. Some vary, but after 2 years, you're graduated with your master's in physician assistant, and you can, once you're certified, you can get a job.
Yeah, I think any of us who have been to a doctor's office, we've been treated by a PA,
Yeah.
and we know that they have an incredible amount of knowledge and skill.
Yes,
Obviously, a lot of education that goes into
Yes.
that.
absolutely.
Is there a limit to how many students can be in the pre-PA?
No, not for my typical course that we started. I am going to convert it online so that way out-of-state students can take the class as well.
And that's a difference from a lot of medical specialties where there's a limit on how many you
Yes.
can have in your cohort.
Right, absolutely. Yep. And because it's not an official program, it's just a track, I can offer this class as many times as we need to fulfill the gaps and keep them going.
Nice. What else do you have in terms of course prep or tracks that you are able to use the Simulation and Innovation Center for?
We are using it currently with all of the health science programs, which has been really just amazing experience. You know, respiratory therapy, nursing, medical assistants, all of them, dental hygiene, every health science program that we offer, but now we are trying to expand outside of the health sciences. So we want to work with the STEAM factory and, kind of branch out as much as we can to start developing more simulations that create a community.
I was amazed. It really is eye-opening to see all that you have. And one thing that did surprise me, Sarah, in talking to you and Brian and some of the other faculty there, was how much more you enjoy teaching,
Yeah.
having these kinds of tools.
Oh, yes. I mean, it makes your job fun, exciting, and to watch the students fully immerse themselves into everything that you prepared for them. I'm not just standing there lecturing to them. They are feeling pulses, they are assessing the patient, their communication with the patient, they're developing those important skills. Just talking to a person in a hospital setting takes a lot of practice, because you feel uncomfortable first, and talking to somebody who's vulnerable or in their disease states or scared, it takes a lot of practice. So that's what we do in the simulation, is have those difficult conversations first.
So you're having some bedside manner training.
Yes. Oh, absolutely. Absolutely, that's very important.
And do you feel like you're getting, with this type of technology, that you're getting maybe a more complete knowledge of everything?
Definitely. It's so amazing what they can do. Like, just being able to feel like, it's like feeling a real pulse, essentially. Like, it feels like a real heartbeat on these. And getting the knowledge to learn how to talk to patients is so big.
So is there a rush when you save that person that was in contact with electrical wires?
Yes, it's just, for me, it was so fun to get to do that. And the big thing in the medical field is just giving the patient the hope that there's a positive outcome in the end.
Yeah.
Yeah, there's a lot of heart. People have to, there's a talent that someone has to have, not just the skill.
Yes.
As a personality, you have to have that treating, that Florence Nightingale type.
That's it. Yeah.
What's your day like? So do you take classes at JPEC and then go over there? Or what's your schedule
I
like?
actually finished my high school classes in 10th grade, so I just am doing college right now. I take some in person, some online, and that's where I'm at, really.
Awesome. Well, that's pretty cool. And there's others that can be just like Gloria, right?
Yes.
When's the next series begin? Next semester?
Yes. Yep. Next semester. So that's spring semester.
Okay.
Yep.
And what do people need to know to sign up? What do they need? Are there any prerequisites?
I think the best thing would be to connect with a student navigator, because there are so many different programs and tracks and way to do it. Even, as a high school student, just starting with the navigator, somebody who's experienced and knowing what all the prereqs are and their requirements would be the best way to start.
Awesome.
And we're happy to show anybody around anytime.
Yeah, can people come out and get tours and check
Yeah.
out everything?
Yeah, anybody's more than welcome to reach out to me and I'll give them a private tour. Absolutely.
Well, great to have you both here. Thank you.
Thank you for
Thank
having
you.
us.
Yeah, and good luck, Gloria, and we'll be excited to hear how everything goes. Check back with us when you're newly minted as a PA,
Of
okay?
course. Thanks for having me.
From Jackson College, faculty member in the Simulation and Innovation Center, Sarah Case, and brilliant student from JC and JPEC, Gloria Monroy. Thank you.
Thank you.
Thank you.
Well,